Hello, my name is Dr. Ian Grant-Whyte. I'm a Cambridge University medical graduate and a diplomat of the American Board of Family Practice. I've been asked by the Maricopa County Medical Society to do a video or two on cases that I think might be of interest to the doctors of today and the doctors of tomorrow. This case involves a woman, a 45-year-old patient who came to my office complaining of a lump she thought she could feel in her left breast. She'd had it for about, I don't know, a month, and it wasn't painful, and so I examined her carefully. I did my usual meticulous breast self-examination or clinical breast examination. I couldn't feel anything. I checked in her axillae, supraclavicular glands, I checked her liver, make sure there were no secondaries, and I told her to come back in about 3 months' time. Well, she didn't come back in 3 months' time. She came back in 6 months' time, by which time there was an enormous lump in her left breast, and she had all kinds of lymphadenopathy in the left axilla. This frightened me a bit because, you know, I had sent her for a mammogram, which was negative. I had sort of over-relied on the negative mammogram, sort of thinking that perhaps there was nothing there anyway. However, there was something there, and I had obviously missed an early breast cancer, which was very, very upsetting, particularly because this particular family had lost a 21-year-old son with testicular cancer as a result of their former doctor's misdiagnosis. So I felt that, you know, that I was remiss, and also that my nurse or my office staff had been remiss in not flagging this particular patient and sending them a reminder that they should come back to my office. You would have thought that the majority of women or men or whoever would take the responsibility of coming back as instructed, but life is not always as it seems, and I reported this case to MICA, Mutual Insurance Company of Arizona, my malpractice carrier, and they took the details down and they said, well, you know, you've just got to wait. And I waited and waited. A year went by, 2 years went by, and the statute of limitation went by, and I wasn't sued. So, you know, my advice here is always have a high index of suspicion. If a woman says she thinks she can feel something, believe her, even though you can't feel it. Let's face it, no one can feel a lump smaller than a centimeter in diameter. And but women in this age group, she was 45. In those days they did mammograms on a regular basis, but this mammogram was negative. And I think that you've got to remember that mammography is not foolproof, and act accordingly. And I think, having said that, they were a wonderful family, and the story has a happy ending because the woman had chemotherapy, and I was speaking to her husband. She is in her mid-80s now and alive and very well. Thank you.